living in an artificially induced state of consciousness that resembles sleep. The poor and the underclass are growing. Racial justice and human rights are non-existent. We have been lulled into a trance. They have made us indifferent to ourselves, to others. We are focused only on our own gain. That is their primary method of survival. Keep us asleep, keep us selfish, keep us sedated.
You're listening to Toward Anarchy on the Republic Broadcasting Network. Here's your host, Michael Storm.
Welcome to the show. It's true, it is Toward Anarchy. I am your host, Michael Storm. It must be a Sunday. It's been a little bit dreary, a little bit weary, a little bit wet here in the middle of America today, but it's starting to warm up, which means that it's going to get hot and muggy and nasty, which is never a good thing. But I'm safe and comfortable inside with my air conditioning and my big screens and my microphone and my radio show to do. Thanks for hanging out with me. Thanks for taking the time taking your time to spend a little bit of time with me and listen to me rant and rave for a little bit. Fantastic show planned for you. Once you get past and through me and all of my silliness, get a great conversation for you. Free market is principle to liberty. Remember, principle, that's my new word now, as well as to individual health decisions, a principle to liberty as well. So James Dunavant is the executive director of the Free Market Medical Association, and he's my guest today. He'll join us in about half an hour, and we will discuss the free market. We will discuss how FMMA helps medical service providers bring the free market to their product and helps them bring their product to people. We'll talk to him about exactly how he can help people find the free market medical services that they need and the work that they're doing there at the Free Market Medical Association. It'll be a great conversation coming up here in just a little bit. As always, if you go to towardanarchy.com, you can follow along. You're looking for August 9th. That's the time it is in my world at the moment anyway. If not in yours, just click on the archive and you will find the links and everything that I have shared for you under August 9th. That includes a PBS report on how authoritarianism has spread right along with the coronavirus pandemic, as well as Crocodile Hunter. Not the guy that was famous for teasing and poking wild animals. No, this is a device, a software program, a combination of things that that helps to sniff out the hailstorm stingray devices that are snooping over the 4G activity. You know, they set up these fake cell towers. The police will do it. And they're called these Stingray towers, and they just capture your phone information. They capture your calls, all the activity that you might otherwise experience going over these using the network is being captured by these Stingray towers. And up until when it hadn't been too much of a big deal until they reached 4G, it became harder and harder for them to catch them, and now they're showing some real progress in being able to stop the snooping activities over the 4G system. And of course, I have this problem. This thing happened this week. It happens a lot. I get disrespected. I'm sure you feel this yourself. But last week on the show we talked about private property rights. Amazing show, one of the great shows, really. Just such an amazing guest Lindsay Thomas was. That's up there at towardanarchy.com. You can find that in the archive. It was August 2nd. Listen to that conversation. Fantastic conversation. All the right things said about property rights, about private property. And so, of course, the reason that I had that conversation is because right now, during this period with COVID-19 and what's going on in the stores and the way people are being told that they have to wear masks and the potential of a vaccine being forced on us here in the near future, this question of private property rights is is huge. It's going out. It's everywhere. Everybody's battling about it. And as I said last week, going into it, and in the weeks leading up to the conversation, because I knew that it was happening, is that we needed to have this conversation because people just don't get it. They're not people who are supposed to, right-leaning people who support the Bill of Rights. That's extremely important for those people that say that they support them. The Constitution is literally a document designed to protect property, the individual and their property rights. That's what the Constitution was for, at least the argument for the protections that it supposedly offers, is protecting people and their property. We can argue about whether or not it really does those things, whether it really serves that purpose or not, because well, we probably know that it doesn't. Not very often. But what's happening is we're seeing these people. They're supposed to be voluntarists, anarchists, libertarians, supporters of the Constitution, who are missing it. They keep missing this private property rights thing, and its principle, its core, it goes to everything that we supposedly believe in. And so when they miss this, it's very, very hard for me to listen to them on something else. You know, there are only a handful of ideas, things that I will just shut you down when you're on the wrong side of it, and that's one of them. And it's disheartening to see. I have a good friend, Dr. D. I've been trying to convince him to come on the show. He doesn't want to come on the show. He's like you. He doesn't listen. He doesn't do the internet. He doesn't use computers that much. And I know that some of you are like that. He gets all of his news like this. This is it. And I'm the first person to tell you that what I'm talking about here, what I'm telling you, unless I clearly state that it's somebody else's words, that it's just my opinion. All of this is just my opinion. The existence, my reality as I see it, all of it is subject to my opinion. And I make that very clear to you coming across. And what's happening is we're seeing that people who are not connected to information because they want to avoid the negativity on the internet, on the social media, they have a false sense of the success of their party. In this case, I'm talking about the right. I'm talking about people on the right. I'm talking about the Republicans. I'm talking about QAnon followers. I'm talking about people who only listen to Alex Jones, who only listen to the couple of guys that they turn on the radio, and that's it. And they don't really do anything else. They're just as bad. They're just as guilty of getting their information from inside their Overton window as anybody is when they do it that way. Oh, sure, their information is so much more enlightened. Oh, I won't even try to be sarcastic about that. I can't be, because it's true. It's right. But it comes back to something I mentioned last week in the show, and that was this idea of trying to stop myself from making these constant appeals to people's emotions. And while I'm making an argument that I believe to be backed by facts, to have data to support it, I'm simply understating or even overstating my position on some of these things by responding to, I was asked this question specifically, and this is what brought this about. I was asked the question, what do you think of universal basic income? And I said, taxation is theft. And that's not an answer to the question. Yes, it is. I know. I understand that. In my mind, it is. But this is all leading to that same thing where we're all doing this. We're all having the same problem where we're used to conversing with people who understand what we mean. So when we talk about certain things, we can leave out information. We can talk to people we know who understand what we're saying in 160 characters. We can exist in this 160 character world that we're in right now because in my case, I surround myself with people who understand what I'm talking about, people who support me, people who support my ideas. So when I say things, I don't generally have to clarify them. But then when I'm out in the real world, having a conversation with somebody who doesn't know these things, somebody who doesn't understand economics, somebody who doesn't know the history of America and the manipulations of the political system itself, not just the things that surround it, not just using the political system as a tool to manipulate things around, but the actual manipulations from the get-go of the political system that led it to usurp state power and turn that into a federalist system that led to an afterthought that was called the Bill of Rights that supposedly protected the people from the encroaching federal system that they had just created. And all these things that you and I understand, we can have these conversations together, but these other people can't. And so it's very important that we make sure we're clear about what we're saying. And in a situation like this, where we're talking about the private property rights, it should be real simple. If it's not my property, it's somebody else's property, and they deserve their rights to it. It really doesn't matter how they use it. And so that'll be the argument. Well, they don't use their private property that the public has access to in such a way as I feel they should. Therefore, they are wrong. Well, that's not true. It's still their private property. You can think that they're wrong, that they use their private property rights in such a way that is contrary to even the concept of it. If you're going to have private property rights and you invite the public onto your private property and you tell the public that they have to wear a medical device when they're not sick, when they don't have a medical condition, when there is no proof of it, when there's all these other questions in place, then they're encroaching on my rights and on my right to my body, to myself. So I have to make the decision, do I go into that store? Do I respect the rules of their property and go on to it? And of course the answer is, if I need to go on there, if it's economically smart for me, if it's what I need, what they have, what I need on their property, then I'm going to obey their rules. The truth is I don't. So while I'm sitting here telling you this, I'm telling you that you can do this the right way, that you don't have to be a jerk to these people. You don't have to, because one, it's not necessary. They're not going to stop you. I've been into Walmart several times since they've enacted the mask thing now, only because I've had to pick up things that I have to pick up. I've got to go pick them up right now, and they're at Walmart, and they're the best price, and that's where I'm going to do my shopping. And so I go into the Walmart, and you know what I do? I have my mask. I just have this little piece of cloth, and I just kind of hang it on my finger as I'm walking in the door. They don't say a word to me, and I stick it back in my pocket, and I go about my business like I know it. Nobody says a single word to me. Everybody else in there is wearing a mask. I guess for the most part, they stay away from me. I haven't had any problems. You can do this without you violating somebody else or their property rights or anything. It's very easy to do these things, and it should be straightforward when it comes to your decision as to whether or not you're going to. If they were to confront me on the property and tell me that I had to wear a mask, I would make my decision at that point. I would say, do I leave or do I put on the mask and continue my shopping and get the things that I need? That would be my decision at that point. Those are my only decisions because it's their private property. Well, what happens if it's digital? I've talked about this before. Digital is just a circumstance. It doesn't change property rights. It's just a circumstance regarding property rights. So when it comes to violating someone's property rights, if you physically, as it were, break into somebody's digital property and take something from them, that's theft. There's no two ways about it. But if you're voluntarily playing in somebody else's digital sandbox, and you do something that violates their rules, their terms of service, and they cancel you from their service, it's their right to do it. I don't care if they're too big. They're too big because of usage, because people use their service. Walmart right now is the biggest retailer in the world. It wasn't at one time. Somebody else was the biggest retailer in the world before Walmart came along. And they thought they were going to be the biggest retailer in the world forever. Just like Walmart thinks that it's going to be the biggest retailer. iTunes thinks that it's going to be the biggest delivery system of digital data, such as it is, music, podcasts, things like that, in the iTunes store for apps across the phone. This is kind of what brought this conversation up and where we have to wrap this thing up. Because thankfully, my guest is coming up and we can get on to something else because this conversation is giving me a headache. Nobody's listening. It's such a simple thing, the property rights thing. Apple comes along and says you violated their terms of service. They make it so that you can no longer sell product across their platform. What's the problem? You agreed to their terms of service. You violated their terms of service. The penalty was spelled out in the terms of service. What is the problem with them exercising their property rights? Just because it happened to you? Just because you don't like the information that they've decided to block because it might be political? None of these things matter. I get that they matter in this some sense of morality, in some sense of everybody expects to be able to go and find what they need on iTunes or a place like YouTube or something like that, and or Facebook or whatever, and if they twist the results, why do you think that market players win and lose? Because they don't do what people want. Why do you think people continue to use a product or a service? Because it's the best. Because it's the only one, because it is what it is, to use that obnoxious term. All of these things, when we're talking about, especially the social media and these platforms, these things are all voluntary. These things, while the public uses them, and a lot of people are still trying to figure out how to use them properly. Most of the world is still trying to figure out how to use the internet to its best advantage. Certainly the individuals in it. And so the temptation is for people to manipulate, to try to coerce people into doing what they think is right with their private property. And when a huge named individual, I'm not going to name him because I'm not that guy. I'm not picking fights and I'm not trying to score points off of this person. This is a huge person. If I said this person's name, you would go, oh, that guy. And you would say, I think that guy's great. Or you might say, I think that guy's a wacko. Just a complete wackadoo. It's a possibility. You're going to be one or the other on this guy, but you're going to know who he is. And he comes out this week and starts talking about how it's not right that Apple uses its own property in that way, where they revoke the developer account of a small independent developer. And my response to him was, and I tried not to be flippant. I even made it clear without, me trying to be funny, but you put all your apples in one basket. What do you expect? So it's the iTunes store. It's Apple. Haha. The reality is, though, you don't see that happening here. I'm an independent person who's using somebody else's digital platform to deliver my message. I'm following their rules, as it were, voluntarily, but I don't have all my apples in one basket. You can find me everywhere on the internet, not just one place. I do want to see it painted black. I want to see all the markets painted black. Black markets not controlled by third parties. True free markets. It's one thing to provide a place for somebody to do something. It's another to manipulate and to alter the way that they do things. It's part of the same conversation. The conversation never ends because these things are all tied together and they're all core. And if we're going to come to some sort of understanding about letting the individual be an individual and still have us participate in a society and want to work together to create things, to build the world around us, we have to understand these simple, basic ideas. They're so simple. It's not mine, so I need to keep my hands off of it. That's a real simple one. This is not my place to speak unless I'm asked to be spoken, unless I'm spoken to, and they're asking me to speak and to say something and to put my ideas forward. If I'm not allowed to speak here, then I'm going to move on to some place where I am. If I'm not allowed to protect myself where on this person's property, then I'm not going to go on their property unless I absolutely have to. This is all. It's all coming to a head. What I started to say about Dr. D, my friend, is he's one of these guys who believes that statism is ending. He thinks that what he's seeing right now, because his view is limited, he very much has surrounded himself with an echo chamber. He very much has his own Overton window that he is seeing things through. And he believes that statism is dying. And how do you see this? Where do you see this at? I see maybe one version of a state dying. I don't see statism dying. I see more and more people every day clamoring for some third party to intervene in their lives. The only thing is that they don't realize it's mostly because of third party interventions into their lives that they're in a position where they're having to beg for some sort of intervention. These people down on the street that have been protesting for the last 90 days almost now, they don't know what they want, and what they want ultimately is for somebody else to do something, because if they were going to do something, they wouldn't be down on the street asking somebody else to do something, carrying a sign telling somebody else to do something. Save us. Bail out us, not the banks this time. Whatever the sign is, it's there. All they're doing is, I've done it. I've seen the results of it. The fight against police brutality. It was funny because my wife and I were watching the last days of Richard Pryor last night, and Richard Pryor made many, many jokes back in his time, back in the 70s, about police brutality, particularly against black people. And, and it was just funny because she commented on it, and I'm like, well, yeah, these people have been out carrying signs and protesting police brutality for decades, and all the police have done is get more brutal. Learned new tactics to abuse people, found new ways to encroach upon their lives and new reasons to invade them and to pull them over and to violate them, to rob, rape, and murder them right on the street. But they're still going to just go out there and carry a sign. Instead of raising a voice to people who are listening, nobody's listening. You're blocking the road. You're just pissing off people who need to go to work. That's all. and shooting each other when the car comes speeding. Have you seen that one? Oh boy, this truck comes speeding. I think it's in Colorado. A truck comes speeding through the crowd, and so one of the bystanders, one of the people in the crowd, opens up on the truck and shoots somebody across the street that's there protesting too. This is the kind of mentality that exists down on the street in the protest, and these people are supposed to be the future. Dave Chappelle thinks it's in good hands. Oh my. The confusion and the misunderstanding about such simple, basic things. I don't understand where it comes from because it's all right there. It's all right at your fingertips. If you're not getting in it, this is my argument with my friend Dr. D. He has to expand his knowledge base. His knowledge base is fantastic. It's great, but he surrounded himself with people who are too like-minded. There aren't enough ideas from other people seeping in. It's August 9th. Go to towardanarchy.com. My guest is James Dunavant. He's the executive director of the Free Market Medical Association, and he's coming up next right here on Toward Anarchy.
You are tuned in to the Republic Broadcasting Network. Visit our website by going to republicbroadcasting.org.
You think you're some kind of Jedi waving your hand around like that? Jedi mind tricks don't work on the Darian. They won't work on me. You can't do it. TowardAnarchy.com. Go to August 9th. That's what you're looking for. And hopefully we're all set up here and everything is ready to go. I know I jumped the gun last week. Yeah, okay, we're in and we're sound checked. See, it helps to look before you jump right in. I jumped in last week and we weren't ready. Not that it took a second to get it back together, but it's just kind of funny. Just throw yourself off like that. Just dive right in. Just dive right in. TowardAnarchy.com, August 9th, the free market, it's principle to liberty, individual health decisions, principle to liberty. James Dunavant, he's the executive director of the Free Market Medical Association, a new friend of mine, just becoming friends with him on the social media and across, conversing about setting up to get him to come on the show and talk to me about this wonderful thing that he's working on, because I want to know more about it, but I know you want to know more about it too. So thank you so much, James, for joining me today and telling us about what you and the FMMA, I keep missing that other M, what you guys are up to and how you're helping change the face of medical services for people. I really appreciate you taking the time.
All right. Thanks for having me.
So let's hear a little bit about yourself. We don't know each other, and this is always one of these things where it can always be a little weird to try and break the ice, but we already have a lot in common. We're free market supporters. We sort of like the sort of anarcho-economic ideas, Austrian economic ideas, it would seem. So we have this ground to start off on. Tell me a little bit about yourself, how you come to have these kind of ideas and how you come to be involved with something like a medical association at all.
Yeah, well, that's a very good question, very long story, but after college, I guess, my first experience in the political world was the 92 election with Bill Clinton and George W. Bush and, of course, Ross Perot. And I really didn't care all that much about politics, but there was something about Ross Perot that just kind of appealed to me as this sort of renegade guy that was out there just sort of telling a straight shooter. So I started looking into, different ideas, and I eventually came across Thomas Sowell in like the early 90s and read some of his books and became a huge fan. I was already kind of a small government conservative, I guess you would say, at the time. Well, Thomas Sowell, I guess, led me to kind of a brief hiatus with Milton Friedman and then eventually to Friedrich Hayek and to the Austrian school, specifically Ludwig von Mises. And so I started reading LewRockwell.com and following the Mises Institute in like the late 90s. So I've really been a hardcore libertarian, anarcho-capitalist, I guess, since the early 2000s. I guess during the George W. Bush years, I fully realized that the Republican Party was just not giving any of the answers. They were just, increasing government spending, and I finally realized that the military-industrial complex was just another big government program. So I've really been following those lines for quite a while now. My career-wise, during all this time, I started out, and I've worked in sales and marketing for almost 10 years in the corporate world. And then about 12 or 15 years ago, I got into higher education and sort of saw the good, bad, and the ugly of the education system as I was working in development to raise money for colleges and universities. And about 4 years ago, had the opportunity to start working directly with the Mises Institute, doing fundraising and development with the Mises Institute, which I feel is the gold standard for free market thinking and economics speaking. And in that time period, I met Dr. Keith Smith with the Surgery Center of Oklahoma, who is also a very, hardcore libertarian. And he's a guy who took the ideas that he learned from Mises and Rothbard and applied them in his field, and decided to basically start a secession movement, I guess you would say, in the medical world, and get out of the crony corporate crony capitalism system of healthcare that has really grown over the last years. Of course, we can talk about how the government created all that, and I guess we would agree on all of that. So the beauty of my journey, I guess you would say, where I come from, is that I feel like I'm now being able to, with the work I'm doing with Dr. Smith and the FMMA, to sort of incorporate the theory into the practice of my political philosophy, or economic philosophy, I guess you'd say.
That's really great. I think the story that you tell in there is pretty typical. It sounds a lot like my own. I gather we're probably about the same age based on the numbers and the years that you're talking about there, because all of that is very familiar to me. that particular election, Ross Perot, all of those early ideas, to me, politically showing up and trying to find my place, being raised from probably about the time of age 12 on, about the time of age 12 is when I met Ken Riggs. And Ken was a libertarian, big L libertarian, as well as an Austrian libertarian. And so I started learning from him right away. And you get out into the real world, and you try to play the game, right? You try to participate a little bit. You say, okay, well, you're supposed to go and get an education and get a job and vote, and you're supposed to vote for the most principled person in the election. And then you start actually looking at that. When you value an idea like that, you start looking and you see, well, those people aren't particularly principled. And I don't see a difference in sort of numbers and economics in this approach versus this approach. It's still just somebody taking money out of my pocket to give to another, a third party interfering in my business. And that's kind of what it comes down to with the entire medical industry, right? We have the insurance industry, and we have government, and we have this tug of war between the markets and the people trying to play in the market, the providers as well as the people who need the services, fighting to take control over the costs and to expose them in some case when it comes to medical costs.
Yes, and a lot of conservatives talk about Obamacare and how that messed up healthcare, but I think we can go back much further than that. I think most libertarians realize that the medical industrial complex started long before that. I mean, even going back to the institution of medical licensing, that was really sort of a cronyist takeover to eliminate competition, different schools of thought in the medical field. And what we see, not just in healthcare, but in all different industries, is that, when business people decide to do something or align themselves with the government, essentially they've made a deal with the devil at that point. And there are so many unintended consequences if they had good intentions in the first place. I guess we could argue over that. But, all of those things, anything that the government does to, quote, help provide safety and security for people, they always have some unintended consequence that follows from that. And then what we've seen for the last 75 years or so is just one response after another to try to, quote, fix the problem that the government caused in the first place. So here we are.
It just compounds and it compounds, and they never go back to the core problem. I hate this. It's everywhere, and it is so obvious And it's so easy when I'm talking to someone like yourself who gets it. You spent your time, you studied this. Not that it necessarily takes a lot once you open the door, but it's real easy for you and I to sit here and say how screwed up it is and how it all goes right back to government intervention in the first place. And everybody else is still having the conversation that doesn't look back that far. They're only looking back to the last 4 years or the last time somebody messed with the market.
Yeah, and so there are a lot of people that still are looking for a political solution, like how do we repeal Obamacare, or they think that there is a political solution for the mess that we're in. I fall into the camp, and I think Dr. Smith as well, is that we're long past that, and so the best thing from a strategic standpoint at this point is to have a growing number of entrepreneurs that create almost, an alternative, a real market outside of the current system. And I think that's what the Surgery Center of Oklahoma and the Free Market Medical Association are doing, is that it's really an opt-out movement in a lot of ways. If you think about, we're not going to get rid of government schools tomorrow, but what is more transformative is the fact that millions of individuals have decided to opt out of the government school model and homeschool their kids. So in a lot of ways, that's what we're doing in the healthcare sphere, is that physicians that have gotten fed up with the current system are opting out of Medicare, and they're even opting out of the big corporate insurance contracts and trying to restore the relationship between buyers and sellers. And in healthcare, the fundamental buyer and seller is a physician and a patient.
Yeah, that's absolutely right. And it's a conversation that I have to have all the time, because we're at this point where people, we have 90 days of protests, almost 90 days of protests now on the street, and it's something that's pretty unprecedented in America, certainly in our current time. And so we have a lot of people struggling to find a third party, another solution, and unfortunately they tend to sort of turn to authority. And when it comes to the medical system, a lot of these industries, really any core industry, it's been manipulated for so long that if they continue to stay in that system, they're never going to become free of it. They're always going to be tied to whatever manipulations, whether it's the dollar or whether it's the market itself, or whether it's the services that one can or can't have because it's controlled by some socialist government dictate. Whatever that is, what we need to be doing is building parallel systems. We don't have to burn down the courthouse. We have to build places where people can go to have their disputes argued out without a adversarial third party, as the case may be.
Yeah, Dr. Smith likes to say that Medicare doesn't need reforming, it needs a competitor. And that's really the big problem, is that the government will create a monopoly in a certain area, and often they create some kind of de facto monopoly for one group, like the big hospital systems, the big insurance companies, and allow them to basically create a cartel where they can hide behind a lack of price transparency and raise prices, and they have all these economic incentives to raise the prices. And so really what we need are people like the Surgery Center of Oklahoma and the other FMMA members that are out there creating a competitive market, and get the word out that, going to the big hospital in your town that's going to charge you $30,000 for a hernia repair is not necessary if there is someone, even if they're in another state, that you have to travel to, that has a cash price of $3,000.
Oh my. That's such a big difference. And Well, people are clamoring for it. I mean, we're doing documentaries where people are going to Cuba to get medical service. So obviously, people are looking for ways to find new medical services, a new paradigm in medical services, and it's great. There's some big steps being made in it. But what's even more scary than the controlled market is it goes deeper than that, because it's so long and it's so ingrained into the system. It actually controls the education. It controls what the doctors put out, what they're allowed to even practice, as it were. They're not even. We have I definitely. I'm sure you've heard of this. This is something that I've come across here recently. You know what biohacking is? Not just the guys trying to connect themselves to a computer, but people sort of in their garage trying to find medical cures for their own problems. You've heard of this? Mm-hmm. That's the state of things that we're in when it comes to the manipulations. We're looking at a total sort of scientific dictatorship when it comes to just the practices of medicine and what people can do within their own practice, and the rights of a patient and a doctor to decide for themselves what services they have, let alone just be able to find them on the free market.
Yeah, we've pretty much collectivized everything. If you think about it, I mean, everything should be at the individual level, an individual choice. And I think individuals should take responsibility for their health care. And then, you seek out a professional that can help you biohack yourself, or whatever you want to call it. And then that should be between you and that professional. And like you said, a third party gets involved, and we have this top-down centralized approach to medicine where it's really become this crony system right now of, pharmaceutical companies that are, giving huge amounts of lobbying dollars to Congress. I mean, you really can't trust a lot of science today, unfortunately, because of the corruption that's involved.
And that's right. It's a scary thing to think of it that way, too, because people don't seem to want to face that particular question when it comes. They're happy to argue left and right. They're never willing to argue without third party, without political interference. What's the conversation without the left's opinion? What's the conversation without the right's opinion? Where is just the conversation between me, the person on the free market who needs something, and the person who provides it? It's a interesting long-term question that we're about to go into a break here. Any second now, some music's going to kick in and throw us into a commercial. So we definitely don't have time for it now, but we're going to have to jump into and talk about exactly what it is the FMMA does for connecting the individuals together, because it's really just as simple as finding that provider. We'll be right back. FloridaAnarchy.com, that's the place to follow along. You're looking for August 9th. If you're not live with us right now, it's in the archive. Just click the link up there at the top. You'll see that we're talking about principles of liberty and them being your health decisions in the free market itself. James Dunavant is my guest. He's the executive director of the Free Market Medical Association. And why do I do this to myself? I have these great, wonderful conversations in this short amount, just a little bit amount of time. Because the reality is that we can talk about this stuff all day and all night, and we would still only just scratch the surface of how important it is and what role government plays in manipulating markets, and how damaging it is, not just to the pocketbook, but to the health, the wealth, the liberty of every single individual in the nation and in the world. James, do you have some thoughts on? I don't. That's why I'm asking you. So don't feel like I'm putting you on the spot. I'm just in case you do. On the president yesterday signing this executive order on drug purchases for individuals, somehow getting us the lowest price that anybody pays in the world.
the idea is maybe sound or the sentiment is good, that there are middlemen in the distribution channel of prescription drugs called pharmacy benefit managers, and they make a lot of money off of this lack of transparency. So what they do is they've basically made a deal. They help push the price of drugs up because they make money off of the discount they can get primarily for employers that are, employers' health plans. But this executive order is really geared for Medicare, so I'm really not necessarily as interested in it. It's basically, the government saying, okay, we're going to put some kind of rule in place for how Medicare pays for prescription drugs, which, I kind of feel, obviously, I don't believe the government should be paying for prescription drugs in the first place. So that's kind of goes against that. But it does shake up the industry for sure. But all of these executive orders, at least on the prescription drug side, are geared for Medicare Part B and Part D.
Well, I mean, isn't it just another one of the examples, just an example of what we were talking about earlier, in that it's just looking to another solution in this already corrupt and screwed up system?
Yeah, that's true to a certain extent. I mean, Congress did allow some exemption for pharmacy benefit managers from anti-kickback laws that they've had in place, that they put in place for other industries. So they've kind of been able to get around that, and they get these kickbacks that they call rebates from the drug companies that they claim that they're passing along to the consumer, but they're actually just driving up the price of the drug. So like we said before, it is a problem that the government created in the first place. So I don't know. I have mixed opinions on that, I guess I would say, but I definitely think we need to get that kickback system out of it. But the best way to do it is to educate primarily employers that are paying a lot of the bill for these prescription drugs for their employees, and the employer can basically try to get around that.
No, that's exactly right. Yeah, it's a little bit of a game. It's that tug of war that we were just talking about. We're going into the top of the hour. Take a quick break, and we will come right back to talk with James Dunavant, Executive Director of the Free Market Medical Association. He will tell us what the FMMA exactly is. We'll be right back on Toward Anarchy.
You're listening to the Republic Broadcasting Network, because you can handle the truth.
You go to towardanarchy.com. From there, you can follow along. As always, you have to make sure to like, share, follow, subscribe, all of those things. Don't take it for granted. Do it. Don't assume that somebody else is going to do it. You have to do it. That's the way we do these things. That's the way stuff gets done. You get up off of your butt and you go out there and you physically do something to change the world. You don't show up and vote for somebody else to maybe possibly do it for you by stealing money from somebody else and giving it to somebody else who doesn't know quite what to do with it as well as you. The conversation that we have, the underlying conversation of all of this, it fits right in because we're talking about the manipulations of government when it comes to markets, when it comes to our own lives, our health, our wealth, the decisions that we make. And the Free Market Medical Association is one of these parallel systems that I'm always talking about building. Yes, I'm not the only one, but I say it a lot. Build these parallel systems, watch the other systems collapse. You build this parallel system and you show other people that it works better. It's better for their pocketbook. It's better for their health. It's better for their mental capacity. It's just better across the board because they're at the core of making their own decisions, and they're doing so and in the most informed possible way, which often when you're talking about the third-party interference, part of that is assuming that they're the authority, that they know what is best for everyone. So, of course, they know what's best for you. James Dunavant is my guest, and he's the Executive Director of the Free Market Medical Association. James, tell me, what is the Free Market Medical Association? What exactly can people do if they go to the website? I've shared that link up there as well as the social media link if they look for August 9th in the archive there. If they click on the link that says visit the Free Market Medical Association website there, what can they do at FMMA? Excuse me.
Yeah, at the Free Market Medical Association, if you are just a regular individual consumer, you can find out more about the free market medical movement and what we're doing, really bringing providers and primarily self-insured employers, because the self-funded employers are the largest cash buyers that we still have out there. I mean, we know from a libertarian standpoint that healthcare kind of got screwed up whenever the government linked healthcare with employment, back after the wage controls of World War II. But ironically, right now, the self-funded employers, those are employers that are they're not paying monthly premiums for insurance. What they're doing is they're basically self-insuring, or they're managing that risk for their employees, and they're paying cash for the medical care of their employees. So that represents a huge market of buyers that actually have sticker shock about the price. So, one of the big problems with healthcare is that when people don't really shop for their healthcare if the government or I think a third party is going to pay for it until 6 months later they get a bill saying that, well, guess what? Your insurance company didn't pay for that, or it didn't meet your deductible because most people have a very high deductible healthcare plans, and 80% or so of individuals never meet their deductible. So it does pay for consumers to shop around, but the FMMA is really, our goal is to bring buyers and sellers of healthcare together, and so that would primarily be the independent physicians out there. And I encourage anyone who is looking for a doctor, or think about your primary care physician right now as the starting point for your health. Is your primary care physician an employee of a big hospital? And if they are, then they don't necessarily have your financial interest in mind. Whenever, if you have to go to get an MRI, for instance, they are most likely, say 99.9% of the time, going to send you to their employer hospital where the MRI might cost $3,500, $4,000, and they have no incentive to send you to a free market imaging center that would charge $300 for that same MRI for cash. And so if you have a $5,000 deductible, why would you want to go and, spend $3,500 for an MRI when you could get a $300 one paying cash? Because you're going to have to pay cash anyway if you haven't met your deductible. So on our website, we have something called Shop Health. That's probably a good place for people to go. And what we do is we have our members of the FMMA can post their prices on the Shop Health website. It's shophealth.fmma.org, or you can get it through our website. But what we're doing is we're expanding the principle that Dr. Smith started with the Surgery Center of Oklahoma, of posting all of his prices online. So you could go to the Surgery Center of Oklahoma website if you wanted to see what the cash price, for a hernia repair would be. And so then you could compare that to what your local hospital, or demand that they at least match that price, or you could travel to Oklahoma. Well, what we do with Shop Health is we have a lot more providers than just the Surgery Center of Oklahoma. So you might have a facility that's an FMMA member in Texas or whatever state you're in, where you could shop and see what the actual cash price would be.
I think that's an amazing tool. It was one of the first things that I did when I found out about the Free Market Medical Association. Is I clicked on the website. Anytime I see the words free market, I'm all about it. I jumped on it. and that's what has us here today, ultimately. But I thought that was really neat. You could just go on there. You say, I'm looking for this type of service, and I'm in this area. it's just wonderful. Just type in what you want and off you go. And that's not something people understand is available when it comes to their health. You're absolutely right about that. I went through this some number of years ago, just dental care. And dental is an easy one to do. Some of these others, it seems like they'd be much harder to find somebody who, can fix your hernia, for instance. There are dental people everywhere. It's much more of a free market thing, but people still don't know it. There's still sort of monopolies on areas and places, whereas you can go to, you can go into Vegas. I think you can go into the Vegas area and you can have a tooth pulled for under $100. And here they're going to pull a tooth on you. It's $300. It's close to $300. So it's just something as simple as that. People don't realize that you could just go onto the website, to fmma.org website, and just search for health service like that. I think it's amazing.
Well, we've been conditioned by politicians and the medical establishment to really conflate health care with health insurance, and people have this mindset that I need to have health insurance to cover every little thing under the sun, and so you would never consider having an auto insurance policy that covered having your oil changed. So part of the problem is that we've tried to put every service that should be a cash service that really is very inexpensive, just to go see the doctor, into a high-priced insurance plan. So medical health insurance today is not true insurance. It is more of a prepaid medical, a very expensive prepaid medical plan. So a lot of most of our members of the Free Market Medical Association that are in the primary care business are following the direct primary care model. That's something people should know about. There's a growing movement of primary care physicians that are opting out of insurance and Medicare entirely, and they're charging a monthly membership model, generally $50 to $75 a month. The price might go up depending on your age, but you're essentially, contracting with them. It's not insurance. You're having a membership with them, and you have access to them anytime you need them throughout the year. And you can do telemedicine. You can text your doctor because they don't have to follow all of the ridiculous regulations and rules that the health insurance industry and the government would pose upon someone that accepts Medicare.
Well, it's funny. I brought this up last week when I was talking about having you on the show, just talking about it, as I'm doing during, any normal transition. And it occurred to me that when I was sort of 19, 20, so upwards of 30 years ago, it wasn't that hard to just pick up a phone book. We had this was books with numbers in them. There's some people out there that may not know what these are, that had phone numbers in them because they weren't kept in your cell phone because we didn't have those. You would go and you would look things up, and you would find like clinics, and you could go and you could pay cash for services. You could get, prescribed things for pretty semi-serious stuff. I mean, as long as it wasn't invasive surgery that you needed, you could pretty much just go into a clinic, walk in, pay cash for those services. And over that sort of 30 years since that point, that seems to have faded away. And now, thankfully, it's appearing again. I see more and more private hospitals and medical care providers popping up. Even in my own town here in Topeka, Kansas, there's a brand new one that just popped up.
Yeah, one of the best websites to find a direct primary care physician is called dpcfrontier.com, dpcfrontier.com, and they have a map of all of the independent, direct primary care practices all over the country, and I think there's about 1,000 of them right now. So most areas you could find a direct primary care physician. The beauty of that is as part of your membership, their goal is to keep you as a member. So it's kind of like having a Amazon Prime membership. They want you to stay as a member, so they're always coming up with new services to include in their Prime membership. Well, most states, unless a state like Texas, for instance, has the pharmaceutical or the pharmacy industry banning this in Texas, but in most states, the direct primary care office can actually dispense, just general, very common prescription drugs out of their office for very cheap. You might pay like $2 or $3 for an antibiotic or something. You're just paying cash for it. So just bypassing the CVS and Walgreens a lot of times will save you plenty of money. Plus, all these direct primary care physicians have contracts or they have relationships with those free market imaging centers that I was talking about, where if you do have to see a specialist or get an X-ray or an MRI or something like that, they can save you money just by pointing you to the right place versus going to a big hospital.
That's just wonderful. It's weird because I'm in a position where I know of these things and I understand these things, but then I'm also in a position where I'm paying attention to people who don't. I guess you probably find yourself in a weird position like that too, where you have to reconcile. You have to get your mind around the idea that people aren't thinking in terms. It's just, again, what we were talking about earlier about you and I. We can have this conversation very easily, and we can skip over a lot of the parts where we have to talk about why this is needed, what the importance of having the free market is for. We could skip over all of those things because we get all of that and get right down to the meat of the conversation. And unfortunately, I think we have a natural barrier in people's willingness to try to learn something new as it is anyway. It's just a sort of fear of having to go out into the marketplace on their own and find these things for themselves. I can see how scary it would be, but it's not a scary process. It should be just like anything else that you shop for. It should be a hell of a lot more important than the time you put into shopping for your TV.
Yeah, no doubt. I mean, some economists will try to make the case that the free market doesn't work in healthcare. I totally disagree with that. I mean, it's a good and service that is shoppable. Obviously, there are unknowns and uncertainty that can be accounted for. I mean, Dr. Smith at the Surgery Center of Oklahoma, he puts bundles together, and that gives you a guaranteed price out the door that includes, the anesthesiologist, the time, the facility fee, and everything, so you don't get any surprise bills. So even with that, we do know that there's always going to be some uncertainty when you buy an airline ticket. The airline company doesn't necessarily know that a flight might get canceled or something, so their costs might change, but they give you a price up front. So at least 80% of medical services are shoppable from the beginning, and then just let the market figure out how to manage those other things, those catastrophic things, and we can have insurance to cover those catastrophic things that are rare occurrences. But 80 to 90% of the things are very shoppable and should be.
Yeah, I think a lot of people miss that idea. They think about the catastrophic. They think about the worst case scenario, and of course, people sell them on that. When we're talking about insurance companies and anybody else who might be involved in that particular manipulation of the process, they're going to sell them on the worst case scenario. You need to have the most coverage, the best, to be able to cover this, that, and that. But how many times do we find that it just doesn't cover? And it's amazing how I've noticed personally how it seems like the exact amount that they don't cover ends up being the amount that wouldn't be there anyway.
Yeah. Well, I can't tell you how many times, and people are finding out now that in a lot of cases, maybe even the majority of the cases, you would be better off, even if you have insurance, to leave your insurance card in the car and tell them that you want to pay cash and get a cash price, because you could go to the emergency room, and if you told them you were a cash payer, they would probably, if it's just a basic, thing, it might cost you $150 cash. But if you have insurance, they're going to bill the insurance company probably $500 or $600. The insurance company will come back and say, well, we'll cover 50% of it, and then you still end up with a bill for $200, possibly, so more than what you would have paid cash for in the first place, and a big waste of time.
Yeah, and it's true, and people get they don't. It's the same. They just find out afterward. It's so late. They don't think of the free market when it comes to medical, and people need to switch their mindset to that. I wish people would think in terms of everything in terms of economics. It's a weird thing to suggest, because economics for a lot of people is this Keynesian mess of manipulations that's headed by central authorities and things, but it's really not. Economics is human action. You and I know this. Economics is human action. It's how people will respond to any given input or stimuli, whether it's to do with dollars or health or whatever it is. They're going to generally respond the same way about it. And so to keep them from responding that way, they have to be convinced that there's something different about their health care that keeps it from being a free market thing. We got to go into a commercial, and we'll come back and we'll wrap it up with James Dunavant. It's been an amazing conversation right here on Toward Anarchy. TowardAnarchy.com. If you want to follow along, you can go right into the archive. You'll find what you're looking for. It's August 9th. The conversation we've been having, free markets, your own health decisions. Amazing conversation. James Dunavant's been my guest. I really appreciate you taking the time to hang out with me and talk with me and tell me about what's going on and what you're up to with the FMMA. I really believe it's fantastic work that you're doing there, and I'm glad to be able to share it with my listener. I think that this is just one more example of how we really cure the disease of statism by just simply showing that there's a better way to do things than through miscellaneous, best intended, even at times, third-party interventions. So I really appreciate what you do, and I hope to get a chance to talk to you again, and we'll continue the conversation. Is there anything that we didn't hit on that we need to mention while we've got just a couple of minutes yet?
Oh, wow. Well, I mean, I can talk for hours, and I feel like we haven't even scratched the surface. But I mean, the good news is that there is a growing group of people that are out there that are making strides to move closer to a free market, apart from any government strategy or executive orders, or President Trump has talked about price transparency and trying to mandate that, but we are doing that have been doing that for the last several years at the Free Market Medical Association voluntarily. So we firmly believe in voluntary exchange between buyers and sellers, and hope as more consumers, patients start to shop around, they will look to our members and providers out there to find the best quality and price for their medical care.
Well, it's funny because people think it's a joke. You talk about Walmart offering medical services. To me, that's just the free market doing what it needs to do. There's no joke in Walmart offering free market medical services. To me, I'm up for everybody in the game, because it does what we as economists as understanding a good side of economics and that understanding, because there's obviously others that allow these manipulations to stay in place and keep people believing that they can keep manipulating things in the face of it. I know, the free market knows that that's what's best, and that's what brings down the prices, brings up the services, brings out the quality. All of these amazing things that happen when people voluntarily participate in a market together.
Absolutely. And just like the taxi cartels had thought they had controlled, the taxi system for so long, along came Uber and Lyft that really found a way to circumvent that system. And the technology allowed them to provide that service. And then once enough consumers bought into it very quickly, there was no stopping it. And I feel like the same can be done in healthcare in many areas.
Oh, absolutely. Certainly with, like you said, that larger percentage, that sort of 80 or 90% of things that most of us are dealing with that don't involve, it's probably even a bigger number than that. I mean, realistically, when you're talking about even, when you're just talking about non-trauma type situations, non-emergency trauma type situations, I mean, that's the majority of our healthcare.
Well, yeah, we saw during this COVID lockdown, most every state put a stop to, quote, elective surgeries, elective procedures. Well, a lot of those were very essential procedures. It wasn't like someone's nose job or breast implants that we were talking about. We were talking about some very serious procedures. And so 80% of those things, about 80% of those things, it turns out that that's where hospitals are making most of their money. And so hospitals started losing a lot of money during the lockdowns because they weren't getting those things. So my perspective on that is that should at least tell us that 80% of those, quote, non-elective, non-emergency things could have been planned and priced ahead of time.
Oh, yeah. Yeah, it must tell you something like that. And there's anecdotal evidence out there that suggests that the health of the individual has gone up generally during the COVID crisis because they've stayed away from the doctor.
Yeah.
Particularly, vaccinations was one of the areas that I saw that they were talking about younger kids all of a sudden in just that short period of time not showing up for these so-called wellness visits.
Well, and there's so many pharmaceutical drugs too that people just think that it's a quick fix for, my heart disease or my diabetes or something, and they don't realize that there are lifestyle changes that you can make to reverse these things. You don't have to, and they certainly aren't told that the prescription drugs that they're taking for something that they could change by changing their diet and exercising could have some effect that they don't even realize down the line. It's going to cause some other issue.
Every single one of us is dealing with it. James, thank you so much. I got to let you go. You take care, and I'll be in touch with you soon.
Take care. Thanks.
Well, what do you expect? I was listening to that when I was a preteen. How was I supposed to grow up? Who was I supposed to become? What do you mean? What do you mean? TowardAnarchy.com. August 9th is the date you're looking for if you're not with me live. Just click the archive button, and it'll take you right there. You missed an amazing conversation. Rewind it. Jump back in there. Catch that conversation with James Dunavant. If you have to do that through the archive, I encourage you to do so. If you just missed the live presentation of it, it's another one of these amazing conversations that we just scratched the surface of. We both ended up saying it at one point there because it is. Because again, you and I, me and a lot of other people. We can have these conversations with each other without having to go back to the beginning and start all over fresh as if one of us doesn't know. And I think that unfortunately we end up trying to talk to other people that way too. And we forget to empathize with them a little bit, and we forget to sympathize with their situation a little bit and their lack of understanding. And remember, it's harder for me. So I think I have a right. I think I'm the right person to come here and say it in such terms. It's harder for me to do it because I've been like this for so long. I'm set in my ways for so long, having a basic understanding. I've played around in the system. I've tried to work it, but when it comes back to it, I'm the same person I was when I was, listening to that Megadeth song when it came out in 1985. I do believe was a year on that. So I was, 13 years old, somewhere in there. Not old at all, 12, something like that. It was just right at that age where you're smart already. Hopefully, if you've been playing along and you've had enough of a good supporting background and people around you that at that point you can start thinking for yourself and start developing some ideas, and whether it comes through pop culture or a study of history or of economics or of the law or whatever it is, science, you have this foundation, you have a real start to who you could be. And so if you were already, this is, it explains why you start out younger, why you're more successful at something if you've been doing it for a longer amount of time. You've had the chance to make all the mistakes. You've had the time to be naive. You've had, I have been, that's me at almost 50. I've played the game. I've been successful. I've had failure. I have a wonderful life and family. And so I'm a good example for these things in living in such a way as that other people hate you. I guess that's the only way to put it, because I get poked at so often. It's such a thing for the people who think that because they followed me or because they're my family, because they know me. I don't know what the reasoning is behind it so often that they can tell me in no uncertain terms that I have to be doing things differently or that I'm not doing things right. And that's a weird thing to me. But that's where I am all these years down the road. It's still just the same basic person. And so it's easy to understand why it would be really hard for someone later in life to become enlightened, to understand themselves, let alone the world around them better, and in such a way that reality becomes core, that it's easy to understand, that you can apply the same basic principles of success or failure across the board to everything, whether it's science, whether it's history, whether it's math, whether it's philosophy, whether it's your own understanding of the world, whatever it is, you can apply. If it's just accomplishing something from A to B, if you need to fix your car, or you need to fix your computer, or you want to figure out how to start a business, or whatever it is, there is no difference in any of these things. None of these things are different. The only thing that's different about them is circumstance. I brought this up earlier in the show in regard to a digital violation, a violation of someone's digital property versus a violation of someone's real property. It's just a difference in circumstance. That's all it is. It doesn't change the reality at the core. When you want to accomplish something, you start at the beginning to get to the end. You don't dive into the middle, or you don't get the things done that needed to be done in the proper order. You can't paint the foreground of the picture and then go back in and paint the background. It doesn't work that way. You have to start at the background and paint your way forward. You start with the very furthest thing in the background. That's why you get the sun and the clouds and those are why the happy little clouds and the happy little sun and all that appears long before the happy little trees, because they're further away. They're further in the background. You have to put them down further if you want the stuff in the front to stand out properly and appear to be in the front of the stuff that's in the back. I can do weird stuff like that all day long. Relate all of the different things. It's me. I've lived a life such that I've been able to spend my time being me and being happy and not playing somebody else's game, not playing by somebody else's rules unless I wanted to. Just being free in my mind and in my heart, those places. That's what leads me to here today. That's what I base everything that I approach other people on. I'm not perfect about it. I've never been. I never claimed to be. That's why I work on it every single day. That's why I say that this thing, whether it's voluntarism, libertarianism, anarchy, whatever you want to call it, it takes practice, not study. If you're reading the books and going to the study groups, I'm sorry, Dr. D, if you're reading the books and going to the study groups, you're not practicing. You're not practicing. You're studying. You're practicing theory in your head and your mind. Well, what I recommend, and I wouldn't assume to tell any of you how to live. What I recommend is a little bit more investigation of stuff outside the circle. And that may seem a little weird coming from me because I'm the same guy that tells you it's okay to create your circle. You have to have a balance. I guess that's the only way that I can try to explain it to anybody who's having a hard time following along. You have to have a balance between all of these things, and the biggest balance is in you. And it's the hardest balance to maintain because there is constantly, if you're anything of the world, anything of your own mind, anything of the people around you and that you care about, you're in constant conflict of things trying to throw you off balance, whether it's actual conflict or whether it's perceived conflict, something that is in your mind or in somebody else's mind that is manifesting itself ultimately in a reality. A balance. It's hard to achieve, and I can't tell you how to get it. And nobody can tell you how to get it. Nobody can tell you how to get it. They can tell you how they got it. I think maybe sometimes they can't. I'm one that I can't necessarily tell you how I came about it. It is absolutely a culmination of my being and the people and things that I've come across in my reality. But it's a lot of me. There's a whole lot of me. I again just still being generally that same person. And so what I'm getting at is that you don't have to sacrifice self to be a part of everything. You don't have to actively try to change other people or influence the world around you in that sense. I'm a path of least resistance guy. I'm like water. Oh, let me drop that one on you. Be like water. Bruce Lee. I don't know that much about him, but I love karate movies. I love good karate movies, and I love the things that I've heard that he's said and his general philosophy on life. And that's it's something that I didn't know I tried to be. I didn't know I tried to be like water until I heard that phrase at some point. I was like, oh, okay, yeah. Why am I? Water. It's there. It cuts its way through rock when it has to. It just takes time. It just takes its time. And I do that with everything. I'm actually I'm getting a little worse on the roads about being just a little bit slow. I'm just kind of like, I don't have any place to be. I don't have to be. Nobody's life depends on me. Nobody is waiting for me to show up to get on with the rest of their life. And it's a beautiful thing to live in that free sense, for sure. Go to towardanarchy.com. Look for August 9th because there's a couple of things that I shared there with you while we have a few minutes left that you might want to check out. Of course, there's the Free Market Medical Association website. There's information there about who and what they are, and you can shop for free market medical services there. If you are an employer or if you are a physician, a provider of some medical service, you can get involved with the free market medical services that they provide through the FMMA and become a part of it and become a part of change and building those parallel systems that must exist to show that the other systems are flawed. These systems have to be there in place to be able to catch the other people when they fall. They have to be there when that other system collapses, building those parallel systems. Follow the Free Market Medical Association on Facebook as well. That's a really good thing to do. Those of you who are on the social media and doing it, I know there are those of you who are not. I talk to you a lot. I hear you. I hear your cries. I hear the reasons. That's why I have to have Dr. D on this show. He's got to get over this idea that I don't know what it is. That's why he has to be on the show. We have to have a conversation. We haven't had a conversation in a long time. It's been a couple of years since we had a long conversation. We've had the, just the, hey, how you doing? Everything good? Yeah. All right. Okay. On with our lives kind of thing. Oh, did you see that in the news? That sort of stuff, but not any long conversation, exposing the heart and the soul and the mind at the time to each other. We have to do that. And we have to do it here. It's something that must be done because I think it's going to benefit. It's going to benefit me this whole thing is driving me nuts, trying to figure out his mind, and that means I'm trying to figure out your mind because you, to me, are a lot like Dr. D. Yeah, and trust me, that's a compliment. That's a compliment. Even as it is right now, and me trying to figure out where his mind and heart and soul are at. PBS report on how authoritarianism has spread right along with the coronavirus pandemic. Not enough mention of American authoritarianism, but it talks about it. I just thought it was an interesting article because if it's happening there, it's happening everywhere. That's the reality of it. I've mentioned how how this is just the whole COVID thing is that they're just the panic, everything around it, the failures of government. It's all just a power grab right now. The whole thing across the board is a power grab, and it's the same way in secondary markets, in currency markets and things like that. If you're involved in exchanging gold and silver or comic books, whatever it is that you're into, it's just that the markets are wild right now. A crocodile hunter can sniff out hailstorm and stingray snooping activity over 4G. That's a tech thing that you need to find out about and watch if you're concerned about that. I just am one of these people. I realize that this is the tracking device. This is the listening device. Listen and learn. Learn something if you're sitting there listening to what I'm saying, because I'm not saying anything bad. And if you disagree with me, there might be something fundamentally wrong with you. I'm talking to my phone. I'm talking to you too. You cannot buy the revolution. You cannot make the revolution. You can only be the revolution. It is in your spirit or it is nowhere. Ursula K. Le Guin, she's an author, and she's an author that I'm going to read her book that's from. Because it sounds like she has some interesting ideas about utopia, anarchy. It's a book called The Dispossessed, a novel called The Dispossessed from 1974. I'm going to pick it up digitally and read through it because it's about the core of it is about two societies, one that is a socialist society and one that is an anarchist society, and it seems to be on just the surface, it seems to be a very solid analysis of the sort of problems and things that may come up, and I think that like a lot of anarchists or potential anarchists, people talking about the subject because they're interested in it, they may just need to overcome the hurdle of the leftist ideology of everybody has to be taking care of everybody else, and if it's not perfect for everyone, then it doesn't work for anyone. If you get over that ideology, you can find your way to some really core truths about people and about reality. America, this is serious. If you re-elect Trump, you'll be trapped in a fascist dystopian oligarchy which will keep robbing you of your rights and well-being for the benefit of the powerful and the wealthy. And it gets even worse. These things will also be true if you elect Biden. And it was from Caitlin Johnstone. I have no idea who she is. It was just one of these memes that popped up, and it was so true. And I shared it across the network because I have access to the network social media now. They've allowed me to play around there as well as on the air. And I shared that one, and there's some of you guys, you missed it. You missed the point. But that's okay, because we're going to keep talking about it every single week. We'll get you just a little bit closer toward anarchy, right? That's the idea. You have to like and you have to share all this stuff. You need to subscribe, please. You're the reason that the network is here. You're the reason that the show stays here. I don't necessarily want to talk to myself for 2 hours, but I will. But it helps to know that you're there. Like it and share it all. We'll come back and wrap it up on Toward Anarchy. So glad that I have some smart business partners, because I have some naive business partners. I wouldn't call them dumb. Just they haven't been in business and they don't understand economics, and they opened up a business just before COVID that I've recently been involved in. But my other friend, that brought me into the business, he's been involved with almost since the beginning there, and he's kept them from derailing during this whole thing. He's made sure that they paid the rent and things like that, and hadn't asked for any of the, hadn't asked for any of the payroll tax deferments, or none of that. They haven't asked for anything, any extension from the landlord or anything like that, and it paid off. We were able to move without any question into a bigger space, and we doubled our space, and now we have more comics and more Magic the Gathering cards and more collectibles and more toys, and it's just a wonderful, wonderful little world. I've been spending so much time hanging out over there, but it's nice to know that my one partner was like, no, you don't do that right now. For one, you can use it as leverage later when the landlord comes to you and says something, I don't know, whatever it is, whatever it might be. You just say, oh, remember, we kept paying you through COVID. We didn't ask for any favors, now we need something, or now we want to do things this way. And he worked with us. He helped us get out of the smaller space and into a better space. It's not as divided. Unfortunately, the space that they originally moved into was just not well thought out, and it was because they had some odd goals when they first opened the place. But that's I was thinking about that because of the fact that the president signed these executive orders. And one of the things was deferring the payroll taxes, and just thinking about that in the terms of business, and the fact that I'm actually wrapped up in a business right now, even just a little bit. And it's fun. I'm glad that it's a business that I like and it's something I'm interested in, or I would not want to do it. I wouldn't want to be involved in it at all. I would just be like, no, I'm happy to just keep doing what I do, making my money in the black and the gray markets, selling my toys and doing what I do. That's me, instead of opening up a storefront and exposing yourself to government and taxes and business partners and all these other things. It's fun. It's worth it. I'm getting to apply all of these things that I talk about on the show, and all these different ideas. I get to apply them in person and for real, with real people they're not inside my Overton window. They're not inside my box. And so, I'm talking to them, and I'm having to learn new ways to speak to people. And it's exciting. It's fun. I'm getting to practice what I preach, if you want to look at it that way. Next week, the Death Wives, Aaron and Lauren, are with me. They're death doulas, and they are helping people usher in the death. It's a reality for most of us. I think most of you. I'll probably be around for a long, long time, but most of you are going to experience death, and a lot of you are going to fight it on the way out, and it's not necessary. So we'll talk to the death doulas next week right here on Toward Anarchy. You take care.
You're listening to Republic Broadcasting Network, because you can handle the truth.